Hi, my name is Shaylee Nielsen, and my presentation is going to be about skin cancer, specifically about the relationship between skin cancer and college students' perceptions and awareness of skin cancer. Okay, so I just want to go over my brief outline for this presentation. So first, I want to give a brief skin cancer overview for those who maybe haven't heard much about skin cancer and don't really know exactly what it is and why it's so prevalent in the world today. Then I want to go over some knowledge gaps about skin cancer among college students. Then I will briefly address some sun protective behaviors that are recommended by physicians to prevent skin cancer. And additionally, I will talk about whether or not college students are lacking in sun protective behaviors and ways they can improve. I will then discuss some educational techniques that can be used when trying to educate college students about skin cancer prevention and skin cancer education. And then I do want to give a brief introduction to some research and planning on conducting at SUU regarding skin cancer in college students. So skin cancer is the most common cancer diagnosed worldwide. And it is basically an abnormal growth of skin cells. So this results when the DNA in your skin is actually damaged, and this can cause uncontrollable cell growth in your skin, and these are abnormal. And the problem with this is that the control factors that actually limit the cell growth are not working, which just causes this uncontrollable growth that can invade your tissue, and it can really affect your body, especially when it spreads. So skin cancer is also the most common type of cancer diagnosed in young adults, which is why it's so prevalent among college students and why this is an important area of research. There's three major types of skin cancer. There are many more than this, but these are just the three major types that you hear the most about. So there's basal cell carcinoma and squamous cell carcinoma. These do not go as deep into your skin, so they're less dangerous than the other type, which is melanoma. Melanoma is a lot more dangerous. It causes the most deaths in skin cancer patients among these three types of skin cancer. It is more fatal. It's more likely to spread to other areas of your body, and we will discuss why in the next slide. So to understand why skin cancer can be dangerous, it's important to actually look at the structure of the skin and discuss the features of the skin that enable skin cancer to spread to other parts of the body. So as you can see on this diagram right here, it shows the layer of the skin. So the top layer is called the epidermis. This is the outermost layer of the skin. It's usually the thinnest. And then right underneath that, you have the dermis. This is your more thick layer of skin. It contains hair follicles, oil glands, things like that. And then underneath you have the hypodermis, which is kind of a fatty layer. And then under that you have the muscle layer. So in this diagram, we can see an actual melanoma tumor. So melanoma begins in the melanocytes, which are on this diagram as well, which is the innermost layer of the epidermis. So it's not quite into the dermis, but it's just on that lower level of the epidermis. So when melanoma starts there, it can actually spread into the dermis. And the issue with that is you can see there's a lot of blood vessels. These red and blue lines in the dermis, these are blood vessels. And when melanoma reaches those, it can actually spread to other areas of the body. It can be transported to the brain, liver, basically anywhere in your body. And that's when it becomes a real problem. So that's kind of the later stage of melanoma. So that's why it's a lot more fatal when it does get to the later stages. Doctors can usually cut it out when it's just at this beginning stage, like it is in this diagram, because it hasn't quite reached those blood vessels. So it hasn't spread to other areas of the body. So it's a lot easier to remove because it's more contained. So that's why skin cancer education is so important, because people need to be aware that they need to be checking their skin so that when they do see these things, they can get it removed before it becomes a much bigger problem. All right, so there are a lot of knowledge gaps amongst college students about skin cancer. So most college students can actually not name the different types of skin cancer, and most are not aware that melanoma is the most dangerous type of skin cancer. which is a problem because it's something that people need to be aware of. Many college students also do not know about risk factors for developing melanoma. Actually, in one study, only 20% of college students knew that spending time out in the sun is a risk factor for developing skin cancer. So the reason why being in the sun is such a huge risk factor, actually the main risk factor for developing skin cancer, is because the UV rays from the sun can actually damage the DNA in your skin. And when that's occurring so much and so quickly, your skin and your DNA can't repair itself. And that's when you have that uncontrollable growth of skin cells that can lead to melanoma and different types of skin cancer. So that is why spending time in the sun is the major factor for developing skin cancer, especially melanoma. So many college students don't know that, which is really scary. And many are unaware of the importance of catching skin cancer early. A lot of college students don't know that skin cancer becomes more dangerous the longer you have it, and many don't know that it actually can become deadly when it gets to stage 4, stage 5, when it does spread to other areas of the body. So educating college students about the importance of checking their skin to make sure they're catching any skin cancers early is important, because it can actually limit the amount of people who are being diagnosed with later stages of melanoma, which are more dangerous. And many college students are not aware of what melanoma treatment is like. Many might assume that it's just the same type of cancer treatment for any cancers, like maybe chemotherapy, immunotherapy, radiation, things like that. But melanoma is actually a lot easier to treat, especially when it's localized, because you can really just cut it out for the most part. All right. So like I said before, spending time in the sun is the major risk factor for developing skin cancer. So I want to talk about some sun protective behaviors and some misconceptions among college students about them. So first, I just wanted to show this diagram about how sunscreen actually works. So as you can see, there's these two types of UV rays that come from the sun, UVA and UVB rays, and they both can actually enter the skin. As you can see, the UVB rays go into the epidermis and the UVA rays go into the dermis. So those can be a cause of skin cancer. However, when you have sun protection, maybe sunscreen or maybe clothing that can protect your skin from the sun, the UV rays, a lot of them will actually just reflect off of your skin and won't damage your DNA. So that's why that's so important to use sun protective behaviors. So in one study, only 25% of college students reported wearing sunscreen when they're outside, which is a really frightening thought because experts recommend that you're always wearing sunscreen every day. And especially when you're spending the whole day outside, they recommend you reapply every 2 hours and wear an SPF of at least 15. And many college students are not doing that. Many are not wearing sunscreen at all, even when they're outside all day. So that's something that definitely needs to be addressed. And additionally, tanning beds are also a source of these UV rays that can damage your skin. Actually going to a tanning bed once before you're 35 can increase your risk of developing melanoma by 75%. So discouraging college students from using tanning beds is also very important, as well as encouraging them to use sunscreen every day and to use other sun protective behaviors such as wearing a hat, making sure to stay in the shade when they're outside, along with just that regular sunscreen use. All right, so there are several different educational techniques that I would like to address. So a couple of things that I think could be really useful at SUU would be skin cancer seminars. So just having a set seminar, maybe just like 30 minutes to inform college students about what skin cancer is and ways they can prevent it. Another beneficial thing that we could use is posters and booths in the student center, just to let students know about different types of skin cancer prevention, and providing sunscreen samples would also be a really good way to encourage that use of sun protective behaviors. Another kind of new technology is something called UV photography, and this is actually what's in this picture right here. So as you can see on the left, this is just a regular picture. Her skin doesn't look super damaged. She's got some freckles, but you can't really see much damage. However, when you use this UV photography, you can see all of these sun damaged marks on her skin. So kind of using this type of photography may encourage students to use sunscreen because they can actually see, okay, my skin is being damaged. I need to be better about using sunscreen. And I think flyers are also always a good eye-catching way to get students' attention about skin cancer. So for my research at SUU, I would like to conduct a survey to determine knowledge gaps in skin cancer among SUU students. And then that way I can give a more targeted educational approach towards students. And I'm most likely going to be including booths, sunscreen samples, and maybe presenting at the Festival of Excellence. But again, that just depends on the results that the survey gives me. Thank you for listening.